I'm going to show you 5 simple exercises that fix over 90% of shoulder problems, whether it's the rotator cuff, arthritis, or even just muscular tightness. But most people waste time on the wrong exercises and make their pain worse. Hey everyone, Dr. Jeff Peng here. As a sports medicine doctor, I've treated countless patients with shoulder pain. One thing I've consistently seen is that most shoulder issues stem from muscle imbalances or weaknesses that put unnecessary strain on the joint. The good news is that you don't need expensive treatments or complicated routines. A simple, targeted strengthening program can correct these imbalances, reduce pain, and help you get back to doing what you love. The first exercise is a dumbbell lying external rotation. This targets the infraspinatus and teres minor, which are key external rotators of the rotator cuff. Strengthening these muscles is crucial because they're often weak or underutilized in people with shoulder pain. And so by improving their strength, you can reduce shoulder impingement and improve joint stability. So to do this exercise, lie on your side with a light dumbbell in the hand of your top arm. Keep your elbow bent at 90 degrees and tucked into your side. Slowly rotate your forearm upwards, keeping your elbow stable, then lower it back down with control. Perform 3 sets of 10 repetitions on each side. The second exercise is dumbbell scaption. This strengthens the supraspinatus and deltoid, which are critical for shoulder elevation and stability. Scaption trains the shoulder in the scapular plane. This is a safer and more functional range that avoids impingement risk. Start by holding a pair of light dumbbells at your sides. Raise your arms diagonally in front of you, about 30-degree angle to your torso, keeping your thumbs pointed upward. Lift to shoulder height, then slowly lower back down. Aim for 3 sets of 10 repetitions. The third exercise is the posterior shoulder stretch. This targets the posterior deltoid, infraspinatus, and the posterior capsule, which are often tight in people with shoulder pain. Tightness here can lead to abnormal shoulder mechanics and contribute to impingement. To perform this stretch, bring one arm across your body and use your opposite hand to gently pull it closer to your chest. Hold the stretch for 30 seconds, then repeat for a total of 2 times on each side. The fourth exercise is the internal rotation shoulder stretch. This stretch focuses on the posterior capsule and internal rotators like the subscapularis. Improving internal rotation is vital because limited range of motion in this movement can worsen rotator cuff issues. So to do this stretch, place the back of one hand behind your lower back. Use a towel in your other hand and hold onto it with the hand that's behind your back. With your top hand, gently pull up and you'll feel a stretch in the shoulder. Hold it for 30 seconds, then repeat for a total of 2 times on each side. The fifth and final exercise is the anterior shoulder stretch. This targets the pectoralis major and anterior shoulder muscles. Tight chest muscles can pull the shoulders forward, reducing space in the shoulder joint and contributing to impingement or irritation. To perform this stretch, clasp your hands behind your back and straighten your arms. Gently lift your arms upward and away from your body while opening up your chest. Hold the stretch for 30 seconds and then repeat one more time. These 5 exercises should be performed daily. Their effectiveness is inspired by studies showing that a self-managed single exercise program can produce the same outcomes as formal physical therapy for people with rotator cuff issues. Research found that performing exercises at home resulted in similar improvements in shoulder pain and function compared to undergoing physical therapy sessions, and that these results held true over 3 months, 6 months, and even 1 year. With all that said, it's important to follow a few key principles for success. First, progress gradually. Start with light weights or just body weight to focus on mastering proper form and building a solid foundation. Pay close attention to performing each movement correctly, ensuring you activate the right muscles and avoid common mistakes such as shrugging your shoulders or using momentum. Once your technique is solid, you can begin adding light weights or increasing the stretch duration to progressively challenge your muscles. Keep in mind that the goal of these exercises isn't bodybuilding. The primary focus is to enhance strength, flexibility, and stability around your shoulder joint, allowing your muscles to function more efficiently. This will then allow reduction in pain and prevent future issues. By building a strong, stable shoulder, you can minimize wear wear and tear, improve mobility, and ultimately enhance your overall quality of life. Consistently following this exercise program can address most shoulder problems. However, if you're dealing with rotator cuff issues, a more comprehensive rehabilitation program might be even more effective. That's why you need to watch my next video where I'll guide you through specific exercises to help your shoulder feel at its best.